This week on the DO Pulse, Dr. Bonny Ford takes us inside Burrell College's ultrasound and sonogram training. Learn why these skills matter for patient care. Plus, we sit down with representatives from the Tucson Osteopathic Medical Foundation to talk about their support for our students and how we are all trying to make a difference with our student doctors and underserved communities. Plus, we get a look at how Burrell College is making an impact in Arizona by creating partnerships that are building a pipeline to train more doctors and strengthen care across the region. That story coming up. All that and much more, so let's get started. Hey everybody, welcome to the DO Pulse, a podcast about osteopathic medicine, community, and education. I'm your host, Sidney Alvarez. Now this podcast is brought to you by Burrell College of Osteopathic Medicine and sponsored by GCU. Learn how GCU is a credit union that can help you meet your financial goals. Visit gcu.com for more. So I'm super excited. We are in Tucson, Arizona, and I'm joined by two incredible individuals, Nicole Struck and Russell Allman. Did I say that correct?
You did.
Okay, awesome. And we are at the Tucson Osteopathic Medical Foundation. This is your headquarters. Thank you for being on the show.
We're glad to be here.
Oh, absolutely. So, first question I gotta ask you, Nicole. Tell us about the Tucson Osteopathic Medical Foundation. What is it?
Sure. So we're an osteopathic medical foundation, definitely an osteopathic heritage. We try to carry forth the legacy of osteopathic medicine here in Southern Arizona. We were formed after the sale of Tucson General Hospital, which was Tucson's teaching hospital from 1949 till 1986. The sale provided us with our endowment, and now today we use that money to give back to the osteopathic community through scholarships, through continuing education, through support of public health programs across the community.
Well, it feels very inspiring and symbolic. We're here at your headquarters where we have a background of AT Still, doctor of osteopathic medicine. And, Russell, I want to turn to you and I just want to say, how do you all help students of osteopathic medicine? Give us a little rundown on that.
Well, one of our things that we'd like to say is we will help them with almost anything. But one of the main things we do is try to just provide a place of support. A lot of students aren't from Tucson, so we try to give them a space that we can support them. We give scholarships, we sometimes do testing, and one of my favorite things is we do student mixers. So we'll take them out, have some dinner, maybe go to Topgolf or Dave & Buster's or something, just to let them know they have some support here in Tucson.
And that's incredible. It's not just obviously the social components that we offer to our students, but really it goes beyond that. There's the scholarships, there's the academic support. Can you tell us about this?
Sure. The scholarship program that we have exists for the last probably 11 years. It started out really small. Scholarships given in the name of the founders of Tucson General Hospital, who we all owe the legacy of osteopathic medicine to here in Southern Arizona. Over the length of that program, I think we've given about $600,000 or $700,000 in support to osteopathic medical students who have connections to Southern Arizona, whether they are rotating here or they're from the area. Each year, a Burrell student in particular gets a $15,000 scholarship.
That's fantastic. Yeah. Absolutely fantastic. And one of you all talk to me a little bit about, you see our students, you speak to our students. Any characteristics stand out to you all about our students that you can share? I
always see Burrell students as very driven, but also very personable. I think they carry that combination very well, where they are dedicated to what they want to do, but they also just want to make a personal connection with us as well.
And, and make a personal difference, kind of shifting into a more serious tone. I know there are needs in the Arizona community. There's shortages of medical personnel, like across the nation. And then, of course, here you have your own unique, situations. Why is it important for the foundation to work with our students and just try to, scrape away at those shortages. Talk to us about that.
So we really want Burrell students to feel when they arrive in Tucson, no matter where they're from, that they're part of our family. They're a part of our history and our heritage and our legacy. They treat our patients, even if they're here for a month or two, they're seeing members of the public, and they're so grounded in patient care. They're so grounded in making a difference, whether it be in a manipulation technique that they perform on one patient that gives some relief. So grounded in that osteopathic pride and the heritage that we love so much. And again, you're at home here. Feel as if you're at home here. We're your family now.
Russell, I'm going to bring you back in here. At Burrell, our mission is to train doctors to serve underserved communities. And I know that here, Tucson, Arizona, they have their own unique challenges, as we had, talked about earlier. Why is this important from, your perspective here with the foundation?
Yeah, I mean, I live here in Tucson, and Tucson is a really special and beautiful community with people from all different cultures and all different walks of life. And I think both the foundation and Burrell both have that mission to, engage with people no matter who they are, and be able to support them in the best way possible.
Absolutely.
And I hope that we as a foundation can support all the students, and not just when they're students, but as they continue on, and whether it's supporting Southern Arizona or supporting wherever they end up, that they will know that they are more equipped to serve people with love and groundedness and just that beauty of humanity around them.
Absolutely, yeah, thank you for that. I'd like the two of you to either individually or I'd like you to look at that camera, and I want you to address our Burrell students. And I want you to share with them, from your perspective, why it's so important that you want to work with our students. Can you share a little message to them?
Let's start.
Yeah.
So to all the Burrell students, we love you. I know that might be weird, but no, we want to support you in your journey. We think you are the future of medical education and medical practice, and we are here to give you anything, whether it's a study space or a place to just feel like you have some support. You have a family here in Tucson. We are here for you for your journey now as a student and beyond.
Thank you. Nicole?
Oh, that answer was too good. I can't match that. Thanks, Russell.
Love is in the air.
Love is in the air. It's Valentine's Day, right? No, we're so firmly grounded in this support of osteopathic medicine. It goes back to our roots at Tucson General, which was a teaching hospital. We were a huge hub for osteopathic interns and residents. They called us the Kirksville of the Southwest. That was before there were more than 3 osteopathic medical schools in the nation. And we've seen this revival of, with Burrell students having such a huge cohort here in Tucson. We've seen this revival of that sort of, it's the essence of patient care.
Yes.
It's so grounded, so incredible. And we would love to be a part of your experience. You don't have to. We're not being weird about it.
But you should.
I don't want to be creepy. Yeah, you should. You should.
If our students are just general public, somebody's watching, if they want more information on your foundation, where can they get it?
You can go to any of our social media for Tucson Osteopathic Medical Foundation, or you can go to our website, tomf.org.
Russell, Nicole, thank you so much for being on the show. Truly enjoyed it. Thank you so much.
Thank you.
Thank you.
We'll be right back. Dr. Bonny Ford takes us inside Burrell College's ultrasound and sonogram training. Learn why these skills matter for patient care. Plus, we get a look at how Burrell College is making an impact in Arizona by creating partnerships that are building a pipeline to train more doctors and strengthen care across the region. That story coming up.
Life can feel like you're always on the go. GECU is here to guide you through the home buying process with new lower rates. You can apply anytime.
I got approved!
And from virtually anywhere. Apply now at gecu.com.
I didn't grow up seeing people like me in medicine, but even then, I believed there had to be a place for me, a place where someone like me could say, "You belong." I'm a first-generation student, the first in my family to graduate high school, the first to go to college, and now the first to become a doctor. At Burrell College, I found more than just an education. I found people who believed in me. I found purpose. At Burrell College, you belong.
Hey everybody, welcome back. Now I'm joined by a very special guest, Dr. Bonny Ford. She's one of our faculty members here at Burrell College of Osteopathic Medicine. Dr. Ford, thank you so much for taking time to speak with us.
Absolutely, it's a joy.
Oh, thank you. So we are here to talk about using the sonogram machine or sonogram lessons. Tell us about this.
Sure, so as a part of our anatomy curriculum, we use ultrasound devices like these to kind of teach students living anatomy. So it gives them an opportunity to actually learn anatomy by studying it on living people, which is a little bit different than some of our other approaches to anatomy. So they get to kind of think about different relationships that they would expect to see within an individual, and they also have the opportunity here in Las Cruces to scan a patient population. So we work with standardized patients, and so they get the opportunity to work with those patients and think about what it would be like to really scan patients in, let's say, their practice or in the emergency room or wherever they might need to use ultrasound technology.
You know, this is really bringing the hands-on approach to the lessons. Tell me about this.
Yeah, so it's actually a lot of fun. We had a lab yesterday, and the students were very excited to get to come in. They like to get to try out different techniques with the ultrasound machines and kind of get to actually visualize what they learned downstairs in the lecture hall. So we might talk about something like the liver and gallbladder, and this is their opportunity to see what that might look like in a person and where is it actually at. And when you see something like, as an example, we talked about the kidneys earlier this year with our students. So they scan the liver, they see the kidneys, and they realize the relationship between those two different organs. And you kind of get to appreciate that a little bit more.
This is the beauty of, I think, of med school, because you're taking the textbook knowledge and then physically applying it. And as you mentioned to me earlier, you know, the lessons vary according to the body part, correct?
Right, exactly. So we try to give our students, we have a systems-based approach to teaching anatomy, but for some of our ultrasound labs and many of our other labs, we try to go by region, and so we will scan many things in the same area. So if we're scanning something like the liver and gallbladder like we did yesterday, we also have the students look at the abdominal aorta and the inferior vena cava, which are structures that are very nearby and have important relationships with what we're kind of, our main focus is in an individual lab.
Talk to me about some of the equipment that we have here. We can see this one here on the side. Just is this a standard piece of equipment?
Yeah, this is pretty standard. So you will see devices like these at hospitals, or if you go in for any kind of imaging, you'll see something like this. We call these our tower units. So it has a big computer with it, and then different types of what are called ultrasound probes. And so depending on what area you're scanning, what you're looking at, you might need to use a different type of probe to get the best image of kind of whatever area you're in.
Now, I was to say, through the beauty of editing, you know, folks, as we're having this interview, are able to see physically what's going on. So it works by, you have the probe, as you say, and I guess you add some of that gel, that cooling, or is it a cooling gel? What is it exactly?
No, so what we have to have, so since ultrasound works through sound waves, you have to have a medium for the sound waves to travel through. And so the gel is your medium. So you have to put the gel here on your probe. That gives you a place for your sound waves to kind of travel through to get into the body. And so the gel is kind of the most important part almost, because if you don't have enough gel, as our students know, you won't get a good picture. So we go through a lot of gel.
Now that's one piece of equipment, and we also have, I call this the portable one?
Yeah, absolutely. So this is something that you would be more likely to see maybe in your family practice doctor's office, right? If they want to do a quick scan, you're in, maybe you have some knee pain or something like that, they use these handheld devices. So these are a little bit less powerful than maybe one of these towers, but you can still get a pretty good quick image of whatever you're interested in looking at. And so these ones are wireless, which is kind of nice. So they connect to something like an iPad. You could connect it to your cell phone, anything that has like a way to have a picture, basically. So there's an app that you use. And so they can see, whatever anatomy that they're looking at by using the wireless probe and a iPad, any other kind of tablet.
That's pretty awesome. Yeah. What kind of advice or what words of wisdom could you share with students about maybe preparing, for this lesson or takeaways for them?
That is a great question. So I think the most important thing about preparing is we always provide a lot of demonstration materials.
Yes.
So Dr. Hammer, who is one of our faculty at the Melbourne campus, is our ultrasound. I'm going to call her a guru.
Yes.
And so she films lots of demonstration videos for the students to watch prior. And so those are really important for them to kind of view before coming into lab, so they know what things should look like and also what types of techniques you want to use to get the best image of the anatomy that we're looking at.
Because as you mentioned, it is about the technique, right?
Yep.
Is there a particular way that you're supposed to brush up against, the body or hold the probe? What could you share?
Yeah, it's dependent on where you're scanning, kind of what your approach is. But the easiest piece of advice is that you want your probe to basically be pretty much perpendicular to whatever you're trying to scan, because you want those sound waves to go to that area most effectively. And so that's where you're going to get the best image. And sometimes that's difficult if you're trying to scan, let's say, something like the heart, where there's lots of other things in the way. And so there's certain approaches that you use, kind of standard positioning of your probe to get the best image.
Awesome. Dr. Ford, when I think of a sonogram, the first thing that comes to mind is checking a baby or pregnancy, correct? But there's so many different reasons for a sonogram. Can you maybe just share a little bit?
Sure. So I think the easiest one that people might be able to understand or kind of appreciate is you have an individual who is maybe in a car accident. They come into the emergency room. You would like to do a quick assessment on any areas that might have been affected. If you have blood pooling anywhere, fluids that are traveling in areas that they shouldn't be, you can do a quick exam, which is called a fast exam, and you scan in areas where liquids might pool to make sure that everything is okay. So it's a very quick method, non-invasive, to make sure that the individual is doing okay, they're stable, and we can kind of investigate further other injuries.
Beautiful. Thank you for this. Dr. Ford, do you mind if we talk a little bit about you?
Sure.
Is that okay? Why did you want to teach? Why did you want to go into teaching?
So I think that's a great question, and for me, I have, I took an interesting path into teaching. It was not my original goal when I went to graduate school. But I started teaching as a grad student and found that I actually really enjoyed it. And I shouldn't say that I never thought my main problem was I actually have a fear of public speaking and talking in front of people.
And we're just happy to hear your camera, yeah.
And so
you're doing great. You're doing absolutely wonderful.
And so I was like, I could never do that. And in actually interacting with students and starting to teach and kind of developing my methodology, I found that I really enjoyed it. It was something that I felt like I was good at, and gave me a purpose to my life, something where I felt like I could actually do something meaningful.
Yes.
And so that's how I got into teaching, and specifically teaching here at Burrell with our osteopathic medical students.
So let's talk about that. So give us a little bit of a rundown. I know that you were educated here in New Mexico. Tell us about this.
Sure. So I'm originally from Las Cruces, New Mexico. I grew up here, went to high school here. And so it's really interesting for me to actually come back to this community as an adult with a family of my own and kind of experience it from a completely different lens. Because as a child, you kind of, I don't know how many other kids are, but I didn't necessarily appreciate the joys of Las Cruces. And so I moved away for, almost 20 years before I came back. And so it has been actually very enjoyable to be back in my hometown,
yes,
with my local community and appreciating it more than I did as a young person.
Well, we are all very fortunate that you're back here helping our students not only in New Mexico but also in Florida. We thank you so much for your time, and we wish you much success.
Thank you so much.
We'll be right back. But coming up next, we got to look at how Burrell College is making an impact in Arizona by creating partnerships that are building a pipeline to train more doctors and strengthen care across the region.
I became a doctor because I wanted to do more for my family, for my community, for the people living in places where healthcare is hard to find. My parents built a life from the ground up. They taught me what hard work and sacrifice really mean. At Burrell College, I found more than just a medical education. I found purpose. Hands-on training, mentors who believed in me, and the chance to serve the communities that shaped me.
Dr. Grant.
Thank you so much.
Congratulations.
Thank you so much. Today, I'm an emergency medicine physician, right where I always wanted to be, on the front lines in my community, helping those who need it most. At Burrell College, you belong.
In Tucson, a growing community needs a growing healthcare workforce. That's why Burrell College is partnering across the region to build a physician pipeline. Here's this story. For Burrell College student physician Tyler Peters, training in Tucson isn't just part of medical school. It's where he's beginning to imagine his future as a physician.
My grandfather was a urologist here in Arizona. Unfortunately, I wasn't able to meet him. He passed away from leukemia before I was born. I feel like I got some influence from him to become a doctor myself.
This connection is exactly what healthcare leaders across southern Arizona say the region needs. According to the Arizona Health Resources and Services Administration, the state's going to be short by at least 2,000 primary care physicians by the year 2030. That's why local healthcare officials say it is imperative to work with schools like Burrell College.
We are both interested in improving the health of the communities we serve. I, as an institution offering healthcare, can't do that without qualified physicians and providers, and Burrell is doing that now.
Certainly one of the big needs that we have is in primary care. Family practice, internal medicine. You know, Burrell is not that far away, it's close. It's a good collegial relationship that helps each other.
Community partners are also stepping in to support student physicians.
We have a $15,000 scholarship that we offer to students at Burrell College of Osteopathic Medicine annually.
Regional training is a key part of addressing physician shortages across Arizona.
I'm a pediatrician here in Tucson. I've been a Burrell preceptor since 2016. I enjoy seeing patients, I enjoy teaching clinically, and helping to mentor our students.
We have approximately 20 to 30 students in third and fourth year. What they do here is they get to experience in real life what they're going to want to go into as a physician.
And as for Tyler, that experience is shaping not just how he trains, but where he hopes to practice.
So I chose Burrell because I'm originally from Arizona, so it was important for me to be close to home, having gone to school in Tucson, and that was a big reason I chose Burrell.
So that's our show, coming to you from beautiful Tucson, Arizona. Now, if you have any questions or story ideas, please send us an email. Our email is communications@burrell.edu. We'd love to hear from you. Also, you can follow us on social media. Our handle is @Burrell College. My name is Sidney Alvarez. I'm your host. Thanks for watching, and until next time.